Dan?
Yes,
So, ultimately you are in India. After a couple of months correspondence with us.
that's right. 5 months of planning.
And you came
78,000 miles, 7,800 miles? 8,000 miles?
Yeah, 8,000 miles, yeah. So you came here for your surgery.
Correct.
Right? What was the problem with you?
Well, I was diagnosed with bilateral hernia, and also had hydrocele and variocele, I think it's pronounced.
Varicocele.
Varicocele.
Bilateral varicocele.
And the treatment in America was, I was told that I had hernia surgery.
Oh, that's right.
Further on, finding out what the treatment used, that they use the mesh technique. Years ago, there was no mesh, I found out. They would pull the skin together and staple it, like shoulder technique,
Right.
you might see, right? Now they're doing this mesh, used to be in worst case
Right.
scenario, you have the mesh. Now it's commonplace. You have to do it, no matter what. Bad, not so bad. As far as I know, it's the only legal way. And the doctor was not even going to tell me this, only when I asked to find the information, was he telling me this is the information.
Right.
I'm sure a lot of people don't even know what is being done
Okay.
to them. Upon further research, started finding out about the complications, the migration, how it moves. Some patients, they open them up again and the mesh is there ready to come out.
That's right.
Sometimes it's so ingrained in there you can't get it out.
That's right.
Chronic pain, horrible pain that people have for the rest of their life. So even just finding out about that, the percentage rate, even 1% is not good, having that problem. That's when I went online, started researching, putting in search for the word no mesh,
Right.
hernia surgery, no mesh, etc. And besides, the only thing I could find out, in America, almost anywhere else, it's not done, and the same thing keeps coming up. The Canadian method,
The shoulder technique.
shoulder technique, and your method,
That's right.
the mesh-free
Yeah.
technique by Dr. Desarda. So then that's when I started planning, saying, well, this is what I want to do. I know it's far distance. My insurance couldn't cover it, which I have basic insurance back home. So I was going to save the money, put the money together. 5 months planning, and here I am.
That's right. That's right. You know what is mesh? They use mesh for the repair. You know what is mesh?
Some plastic of some sort.
It is a cloth.
Cloth.
It is a cloth. It is just like your synthetic
Straight cloth.
synthetic shirt. If I ask you, Mr. Dan, if I ask you, I cut down a piece of your synthetic shirt and use it for your hernia repair. Will you allow me?
No.
100% no. Because you are aware that putting a piece of shirt inside your body is nothing but inviting trouble like long. Then what is mesh? So mesh is also a cloth prepared from synthetic threads like polypropylene or fluoro.
Coming back, that confirming your
My technique.
that was also helpful to me, including on your website, there's some testimony from a few American people, which maybe some people would have seen.
Right.
And that helped me too, to have to find out some information from a personal source, someone who was there who did it.
Good.
That's what I would want to say. If someone was watching this and they had concerns and were perhaps thinking about coming here to India to have this, I would want to say right now that 100% it's the real deal. You know, don't have any worries about coming here.
Right.
It's a little bit different culture, but it's no problem.
Correct.
At all. And I would operate on 5 things, not just the hernias. I had these other things as well. And it's the second day now?
Yeah, that's right. It's third day today. Today is third day after
Some discomfort and some
Yeah.
pain naturally from an operation, some sleep, And now I feel almost 100% even at this point,
Right.
just 2 days later.
So you will operate on Wednesday.
On Wednesday afternoon,
And this is Friday.
12:30, 1 o'clock.
Today is
Now it's Friday, and it's like I don't feel traces of
That's right. Normal.
anything
You can move.
at all.
You can move here and there.
So if I could say that statement and maybe I'm helping with one more person who's going to see this and say, you know, this is what I got to do.
Right.
You know, you can do it.
Yeah.
You can choose however you decide. If you're having some thoughts about doing it this way, I'd say, you know, pack your bag, make a plan, and come here and have it done that way.
You can show that you can walk freely. Just
Walk. Whatever problems I was having before, I'll go on. Could probably live this, not a problem.
Oh, great.
You know? So it's just amazing. The people here, all very nice, all very attentive to your needs. They respect you, they treat you like a person. Most hospitals I go in, like some of the people have spoken about, I get treated like a number. I think Mr. Davis said that. The run around that I get in hospitals back and forth is unbelievable. Here I was treated with respect, like a person.
Yes, like a person. Yes.
Like a person, with manners.
That's
Seems
nice.
to be something that's been forgotten about.
Yes.
So I just want to put that little thing in there, and if maybe by chance it gets on the air, someone's going to see it,
Correct.
they can have some more confidence that this is the real
That's right.
thing. And I'm going to put my email information on his site too.
Okay.
Because I called
Yeah.
a couple of people there, you know, with the run,
Yeah.
and that helped me a lot.
That's right.
So someone wants to ask, you know, maybe they're not sure,
Correct.
maybe this will help
This is-
them change their mind and feel good about it. So that's why we're doing this a little bit today. So
In fact, sir, Dan, let me tell you one more thing.
sure,
I haven't made any patent of my operation technique.
right, it's not
I haven't
patented.
made any copyright of my operation technique.
You're offering it to
Free.
use it.
Use it freely.
Don't even pay for it. You don't have to pay. You can use it.
Give benefit to the patient. Give benefit to your American citizens. Operate then there itself. Why do they need to cross 7,000, 8,000 miles and come to India for surgery?
There's a big argument in America now about healthcare, just the funding of the practices.
Yeah.
Who has it? If you're poor, if you're rich, if you're in the middle, you don't get it.
Right.
That's just one separate thing. But it just boggles my mind. I'm an American citizen. I was born in America. I have a hospital down the block. It's the best hospital. I should be able to go out the door,
Yeah.
walk to the corner, and have what you did here done there.
Yeah, that's right. But you didn't do it there.
But I couldn't, because I couldn't do it there.
Right.
So this is just unbelievable. New York City has some of the best hospitals in the world. They do all surgeries of every kind.
Yes.
And I can't have it done. I have to save all my money and plan and travel to come here. But I'm glad I came here. You know. So maybe some things will change and some people find out they might get a little more well known. But, right, so some other factors. If you're offering it for free, you have a video showing you how to do it. Some people can't watch that stuff, but
That's right.
if you look at it, they can showing you right there, this is how I'm doing it.
I have
And if you watch a picture of mesh on YouTube, how they do it with the mesh,
That's right.
look at that compared to the other one and you'll see what they're talking about.
I have prepared.
I had to turn it off. I couldn't even watch the one with the mesh after a while. I got so upset about it.
I have prepared operation series.
Yeah.
So anybody can purchase my operation series, watch the operation in that series, and go ahead with the surgery. Any surgeon can do this.
Mm-hmm.
Because this hernia operation is not a complicated operation. It's very simple operation. Any surgeon, by watching my operation series, can easily operate by Desarda repair technique. I have made it so simple for all American surgeons to adopt and give benefit to you people. It is up to them now. It is up to them.
That's it. So maybe more people find out about it.
That's right, that's right.
You can only hope.
That's right.
Save some people some problems.
These interviews should go on to TV
Right.
or to newspaper media, so that this advantage can be taken by many more American people
Mm-hmm.
and get repair done, hernia repair done, without any foreign body, without mesh. You know?
And no pain. 2 days, I feel.
No pain.
There's nothing like I could even tell, like, oh, this might be some problem as we go.
Yeah, that's right.
It's gone.
In spite of doing 5 surgeries together, you have been operated, 5 surgeries done together.
Right.
One hernia, another hernia, one varicocele, another varicocele, and one hydrocele. So 5 operations done together, and this is the 3rd day. You are just walking and talking like a normal person. Am I right?
That's right.
Yeah. So that's all good about it.
It's all good. That's right. So I guess that's what we'll say for right now.
Okay. Thank you very much.
Thank you again.
Thank you. Thank you.